The state recently announced it is loosening its metrics to allow more kids back in school for in-person learning. But a rise in COVID cases means some counties likely won't meet those metrics anytime soon. Fox 12's Haley Rush talked to a local pediatrician to get his take on kids and going back to school.
It's an ongoing conversation. Should schools reopen or stay closed? Fox 12 spoke with Dr. Justin Sales, a pediatrician emergency medicine physician at Randall Children's Hospital, to get his thoughts on kids and school.
From what you've seen, how does COVID affect most children?
COVID-19 does appear to behave differently in children and adolescents than other common respiratory viruses, such as influenza.
Dr. Sales says while a lot of questions remain, overall kids seem to have less severe symptoms, and that's if they show symptoms at all. As for spreading COVID,
I think we are continuing to learn a lot about the role children play in the transmission of this virus, but at present I can say it looks like children younger than 10 years of age may be less likely to become, as I mentioned, infected and less likely to spread infection to others, although I think a lot of further studies are warranted.
Going off that information, we wanted to ask Dr. Sales this.
Do you think kids should be in school right now?
I think that's been certainly, a national question, a big question for myself locally as a pediatrician and as a parent of two. I think ultimately that decision to reopen schools to in-person learning should be based on guidance from our local and state public health authorities, our school administrators, and family choice.
Sales says relying on current recommendations from the Oregon Health Authority and Oregon Department of Education makes sense, but he understands schools provide much more than just in-person instruction.
But it also provides a lot of social and emotional skills. It provides safety, reliable nutrition. There's options for physical and speech therapy and mental health services for our kids. And additionally, just opportunities for physical activities. So I think it is important that, we continue to follow those public health guidelines and recommendations, and understanding that, reopening a school is important for children and youth, but needs to be done in a safe manner following those current state public health authority recommendations.
When it's time for kids to go back to school, Sales says wearing face coverings, practicing physical distancing, and keeping up with proper hand hygiene will be important to help keep the spread low.
Do you foresee the case number within kids increasing when kids do go back to school?
I think if we follow what we've seen nationally for areas that have opened schools, we certainly do see case rates increase, most notably in the older adolescents. We certainly would expect to see an increase. The question becomes, is that increase significant enough to sort of change current planning?
And right now, it's the current planning Dr. Sales supports.
And you said you have two kids, so I have to ask you this. Would you send your kids back to school right now?
I think, relying on the current public health recommendations, the counties that, my kids attend school in currently are not able to return to school based on the published guidelines. So I naturally would agree with the current recommendations. As of today, no, my kids would not be attending campus.
Now, when schools do reopen, he says if kids are high risk, it's important for parents to work closely with their pediatrician to see if going back to in-person learning is the best option for them. He also stressed the importance of getting a flu shot this season and every year.